Namaskar. I am Dr. Murali Manohar. Welcome to Ayurveda Samhita. In this program, you are going to learn about an important topic and some powerful ancient Ayurvedic secrets. These can change your entire life forever.
Intestinal gas. Many a time, intestinal gas is a cause for humor. But for the person who experiences gas in a public place, it is no longer a laughing matter. As many as 30 to 40% of people experience bloating and gas, which they attribute to gastric trouble. Most of the patients even refrain complaining about flatulence, excessive belching, increased intestinal gas and bloating to the physician, as they are embarrassed. Our intestines cannot digest everything we eat. The leftovers are passed on to the colon. The processing or fermentation of leftover carbohydrates by the colonic bacteria leads to the formation of intestinal gas. While it may appear that some people pass too much gas compared to others, there may not be any difference in the amount of gas produced in the complainers and the non-complainers. It is just that some people are more sensitive and feel it more than others do. Several factors cause people to swallow air. For instance, if dentures do not fit well, the person tends to swallow more saliva, which carries air bubbles with it. If the patient has postnasal discharge, then he tends to swallow more often, carrying more air to the stomach. Smoking a cigar or pipe may also increase the amount of saliva produced and swallowed, contributing to excess gas. Some patients have a habit of belching frequently. To do this, they swallow air, which they then belch. Unfortunately, the patient is never able to belch out all of the swallowed air, thus producing intestinal gas. Rapid eating increases the amount of air that people swallow. Gum chewing and sucking on hard candies also increases the amount of air swallowed. Avoid carbonated drinks. Some gas is also created as the carbonated drink enters the mouth. However, the most common source of intestinal gas is beans. Beans cause gas, as the body cannot digest the complex sugars they contain. These starches pass into the intestine, where they become food to the bacteria present there. While they use the starch as food, gas passed as a byproduct. Similarly, milk is gas-forming in adults. Incomplete digestion of milk can lead to gas, stomach cramps, bloating and diarrhea. Certain medicines like narcotics, calcium channel blockers slow the gut, and may lead to gas being trapped in the bowel, due to slow movement. In Ayurveda, flatulence is called as admana. Treatment modalities include measures to promote dipana, bicarminatives, pachina, bidigestives, and vata-nulamana, by gas expellers. To avoid the problem, drink a cup of warm water with 2 drops of peppermint, pudina, cinnamon, dalchini, or ginger extract. Dried ginger and ajwain, in equal weights, should be steeped in double the quantity of lime juice, dried and powdered. Add a little black salt to the powder. 2 grams should be taken with warm water as and when needed. Tie 2 handfuls of bajra and a handful of crystal salt in a bag. Warm it over the hot plate and foment the abdomen. If the sufferer is a child, you can apply a pad of cotton wool or cloth steeped in hot water, in which asafoetida has been dissolved. Alternately, 1 part of turpentine oil and 2 parts of castor oil can be applied over the abdomen in lukewarm condition. Warmed castor leaves can also be wrapped over the abdomen. Prepare a compound powder by taking equal parts of fried asafoetida, hing, black salt, suvarchia lavana, cardamom, ilachi, ginger, sunth, and solanum xanthocarpum, kantakari. Take in doses of 3 to 5 grams, mixture of 2 parts of celery seeds, ajamuda, and 1 part of fennel seeds, sunfa, and sugar. taken in doses of half to 1 teaspoonful, helps relieve flatulence. For children, there is an user-friendly preparation to use. Take fine powders of 5 parts of ruta graveolens, sadaba, 4 parts of celery seeds, ajamuda, 3 parts of mint, pudina, 1 part of saffron, 2 parts of black pepper, and 10 parts of honey. Keep in fresh bottle and use as and when required, in a dose of 1 1/2 teaspoonful. The common prescription for flatulence consists of ingwashtaka churna in a dose of 1 teaspoonful, twice daily, mixed with 1 teaspoonful of ghee, followed by hot water. Also, taking kumari asava in a dose of 20 milliliters, twice daily after food with an equal quantity of warm water, improves the condition. Don't eliminate all the gas-producing foods at once. Instead, avoid one food at a time. Denture should be fitted properly. If you postnasal discharge, then you should take treatment for the same. Slow down when you eat, avoid gulping food and chew each bite thoroughly. Don't talk while eating. Avoid drinking through straws or narrow-mouthed bottles. Use a glass or cup instead. Don't lie down immediately after eating. Sit for a while. Eliminate carbonated beverages from your diets. Remember that beer also contains gas. Cut back on fatty meats. Exercise regularly. Reduce undue mental stress. Yoga is a good option. Don't use synthetic drugs. Self-medication is dangerous. Be cautious about recycled restaurant tea, as it irritates the inner lining of intestines, thereby forming gas. Hingutragunatala, in the dose of 2 teaspoonfuls on empty stomach with warm water, relieves gas and constipation. Arc-pudina, liquid, if taken, gives results in minutes. Rajvati, Lasinadivati are also effective for flatulence. Avoid these foods that produce gas. Beans, nuts, especially ground nuts and cashew nuts, pulses, black gram and Bengal gram, root vegetables such as potato, cabbage, onions, garlic, cauliflower, radishes, cucumbers, peas, prunes such as jujube fruit, apples, grapes, bananas, bran and whole grains, dairy products and milk, eggs, high-fat foods, fried foods, fermented foods such as dosa, dietary fiber and salads, fatty meats, rich pastries, and cooked chutneys, rich sauces, gravies, thick sambar. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will meet with another interesting and important topic. Satam Jiva, Sarado Vardhamanaha. Satam Hemantan, Satam Vasantan. Live over 100 years old with excellent health and complete happiness. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.